Okay, welcome again. Let's continue with one more online lecture. Alright, so cardiomyopathy means heart muscle disease. So cardiomyopathy is a broad term used to describe a variety of issues that result from disease of the myocardium. When cardiomyopathy develops as a way to compensate for some other underlying disease like hypertension or valve disease, it's called secondary cardiomyopathy. When it develops by itself, it's called primary cardiomyopathy. Here you have the objectives of the lecture that also follow the lecture layout. Now, hypertrophic cardiomyopathy is when the walls get thick, heavy, and hypercontractile. Essentially, the muscles grow a lot, and this is because new sarcomeres are being added parallel to existing ones. Usually, the left ventricle is affected, and in most cases, this muscle growth is asymmetrical, meaning that the interventricular septum grows larger relative to the free wall. These larger muscles do two things. First, the walls take up more room, so less blood is able to fill the ventricle, and they become more stiff and less compliant. So they can't stretch as much as they used to, and again, this leads to less filling. When the ventricles don't fill as much, they don't pop out as much blood, so stroke volume goes down. Thus, the heart can fail to pump enough blood to the body, and this is called heart failure. Because this is due to a dysfunction in filling, which happens during diastole, this is a type of diastolic heart failure. In some patients, the muscle growth of the interventricular septum essentially gets in the way of the left ventricular outflow during systole. And this increases the blood velocity through the smaller opening and pulls the anterior leaflet of the mitral valve towards the septum. This is called the Venturi effect, which further obstructs the left ventricle outflow, and for this reason, hypertrophic cardiomyopathy is sometimes called hypertrophic obstructive cardiomyopathy. An obstructed left ventricular outflow tract means that that blood is forced through a tiny opening, which tends to cause a crescendo-decrescendo murmur. And what is that? Well, a crescendo-decrescendo murmur gets louder as blood first rushes out and then softer. This is very similar to the murmur in aortic valve stenosis. People with obstructive or hypertrophic cardiomyopathy may also have a bifid pulse. This means that two pulses are felt because the mitral valve is moving towards the outflow tract and causes an obstruction in mid-systole. So, with larger muscle mass, the ventricles become less compliant. Remember, this means that they don't stretch as easily when filled with blood. If you are listening on auscultation, often an S4 sound can be heard from the atria contracting and pushing blood into a non-compliant ventricular wall during diastole. Another thing to know is that those larger muscles need a lot of oxygen. We just talked about how the heart has a harder time getting blood and therefore oxygen to the tissues, right? Well, without oxygen, they can become ischemic, and this is thought to be the reason why people with hypertrophic cardiomyopathy sometimes develop dangerous fast arrhythmias, and why hypertrophic cardiomyopathy is the most common cause of sudden death in young individuals, but especially in young athletes. A bit less severe symptom of hypertrophic cardiomyopathy might include dyspnea, which is a difficulty breathing, or syncope, which is fainting. Now, the majority of cases of hypertrophic cardiomyopathy are inherited as an autosomal dominant trait. This type of mutation usually happens in one of the genes that encode for proteins in the sarcomere of the heart muscle. In regards to treatment of hypertrophic cardiomyopathy, it might involve medications such as beta blockers, which help slow down the heart rate. And besides that pharmacological treatment, some people with hypertrophic cardiomyopathy might have surgery. Alright, let's change to restrictive cardiomyopathy that describes when the heart muscle is restricted, meaning that it becomes stiffer and less compliant. However, the muscles and size of the ventricles stay about the same or only get slightly enlarged. Normally, when blood fills the ventricles, they are compliant. This means that they stretch out and allow more blood to fill in. When blood fills restricted ventricles, however, they can't expand as much as they are supposed to unless blood fills in the ventricle, which means the heart starts to fail to pump enough blood to the body. This restrictive cardiomyopathy causes heart failure. Since filling happens during diastole, we call this a type of diastolic heart failure as the previous one. Now, several mechanisms can lead to stiffer heart muscles and restrictive cardiomyopathies. One of the mechanisms is amyloidosis. Amyloids are proteins that have been misfolded, and once misfolded, they become insoluble and can deposit in various tissues and organs, making these tissues less compliant. Familial amyloid cardiomyopathy is a genetic disorder, more common in African Americans. Also, senile cardiac amyloidosis describes how over time amyloid protein deposits in the heart. This is typically seen in elderly people. Sarcoidosis is a different cause, which involves the formation of granulomas or collections of immune cells in the heart tissue. And yet another cause is endocardial fibroelastosis, which happens when fibrosis develops in the endocardium. Endocardial fibroelastosis happens most often in children and is thought to be caused by a variety of diseases and stresses such as infections and nutritional deficiencies. And finally, radiation of the heart tissue can also lead to restrictive cardiomyopathy, and it's so thought to happen because radiation generates reactive oxygen species in the tissue, and over time this leads to inflammation and causes myocardial fibrosis, which makes the tissue stiffer and more restrictive. Okay, and here we have the most common type of cardiomyopathy, which is called dilated cardiomyopathy, which can cause all four chambers of the heart to dilate, get bigger, and here new sarcomeres in the walls are added in series, and the chambers grow larger, which leaves the walls relatively thin in comparison to the chambers. The consequence here is that they have really weak contractions, which means that less blood is pumped in every contraction, and this also means that there's a lower stroke volume, and if the heart is failing to pump out as much as blood to both the body and the lungs, patients develop ventricular congestive heart failure. Since contraction happens during systole, we say this is a type of systolic heart failure. Also, When the chambers get larger, they tend to stretch out the valves that separate the atria and the ventricles. When they are stretched, the valves can close properly, and they just start to regurgitate blood back in the atria. A difficult word when you have a dry mouth. Okay, so this is called mitral valve regurgitation on the left side and tricuspid regurgitation on the right. Okay, so mitral valve regurgitation might be heard on auscultation as an holosystolic murmur. That means that it happens at the same time that systole. All right. Additionally, you might also hear an S3 sound on auscultation, which is the result of blood rushing and slamming into the dilated ventricular wall during diastole. Another complication can be arrhythmias. Arrhythmias are really dangerous, as you know, and this happens because the stretching out of the muscle walls can irritate the cells in the conduction system, which are within those walls, and they may, if they are severe enough, they may lead you to death. This can be diagnosed with the help of X-ray. As far as causes go, primary dilated cardiomyopathy is most often idiopathic. But some causes, however, can be traced back to specific genetic mutations or genetic conditions such as Duchenne muscular dystrophy. Also, in some cases, it can be caused by an infection. In the same way, alcohol abuse is strongly linked to dilated cardiomyopathy because alcohol and its metabolites have a direct toxic effect on myocardium. In addition, certain drugs, including chemotherapy drugs, but also drugs like cocaine, can cause dilated cardiomyopathy. Also, you have beriberi, which is caused by the lack of vitamin B1 and can produce dilated cardiomyopathy. And peripartum cardiomyopathy is an important cause as well, because dilated cardiomyopathy can develop in the third trimester of pregnancy or in the weeks following delivery, and probably due to issues with pregnancy-associated hypertension. However, half of these patients recover completely after delivery. So as you can see, there are a lot of things that can lead to dilated cardiomyopathy. Regardless of the cause, the outcome is a less effective systolic function. Okay, so very concerning. Treatment for severe dilated cardiomyopathy can include left ventricular assist device, also LVAD, which is a mechanical pump that helps the heart in pumping blood, and in extreme cases someone might have a heart transplant. So thank you very much for listening. This was all for cardiomyopathies.
That's all, folks.